Hey future nurses, welcome back to Scrub and Spoon. Hope you're all doing well and thanks for your support. So today we'll be discussing in NCLEX review on cardiovascular disorder, the left-sided and the right-sided heart failure. Okay guys, like always, please watch till the end, comment, like, subscribe, and leave in the comment section the best parts of this NCLEX review. Okay, thank you guys. Now let's go. The first question: which signs and symptoms indicate left-sided heart failure? A. Dyspnea on exertion. B. Peripheral edema. C. Autopnea. And D. Crackles in the lung. And this is select all that apply, okay? And you know how we select all that apply as true or false. So let's do it. Now, dyspnea on exertion. This is correct. This is one of the signs and symptoms of left-sided heart failure. You know why? Because like I have explained before in my other video that left-sided heart failure, you're going to see lung signs and symptoms, okay? So dyspnea on exertion, this is difficult breathing with increased activities because there is pulmonary congestion, right? The left-sided heart failure, there's pulmonary congestion, and when they do too much activities, they started feeling out of breath or short of breath, okay? So A is true, and B, peripheral edema. No, this is a signs and symptoms you will see in right-sided heart failure. So B is false. Autopnea, absolutely, autopnea. Autopnea is difficulty breathing while lying flat, and this is one of the signs and symptoms of left-sided heart failure. Okay, so this is correct. Now, and D, crackles in the lungs, absolutely, lung sound, because left-sided heart failure. So yes, crackles in the lungs is also true for signs and symptoms of left-sided heart failure. So our right answer here is A, C, D. Okay, now let's move on. A client with left-sided heart failure develops a productive cough with pink fruity sputum. What should the nurse do first? A, monitor weight gain. B, recognize pulmonary edema and intervene. C, notes ankle edema. And D, monitor blood pressure of 138/90, guys. And the correct answer is B, recognize pulmonary edema and intervene. Guys, when you see pink fruity sputum, that is the classic sign of pulmonary edema or pulmonary congestion, and the nurse have to intervene immediately. You know why? Because when there is too much accumulation of fluids in the lungs, it's going to affect the breathing, airway breathing and circulation, okay? And you do not want anything obstructing the breathing. So the nurse have to intervene immediately, and that's what makes the answer right. Now let's go through the wrong choices. Monitor weight gain. Absolutely, it's what you should do as a nurse, but it is not life-threatening or it does not need immediate intervention, because when you have left-sided heart failure and you are gaining weight, it means your body is accumulating fluids, right? Which is concerning, but it's not the immediate priority right now, okay? And C, note ankle edema. This is mostly seen in right-sided heart failure, but the main point here is it is not your immediate concern, right? It is not. And monitor BP of 138/90. This is high, but like I say, it is not immediately life-threatening. You want to intervene, nursing intervention for that one that is your priority immediately, okay? Before administering furosemide, which lab result is most important to review? A, creatinine. B, heart rate. C, potassium. And D, temperature. And guys, the right answer is C, furosemide. Now, before you administer furosemide to your patient that has heart failure, you want to check their potassium serum. You know why? Anything that is involving potassium, either high potassium, which is hyperkalemia, or low potassium, which is hypokalemia, the first thing you want to monitor is the cardiac function, because potassium, if it's either too high or too low, will cause cardiac arrhythmias, right? So with potassium, you want to monitor your patient's cardiac function. So now this patient have heart failure, you know, which means the heart is not able to pump blood effectively to the body, right? And they are taking furosemide, and you know furosemide helps you to lose fluids, excrete fluids out of the body. And with furosemide you lose potassium. So you want to be sure that your patient would not already have low potassium before administering furosemide, because that wasn't the case and cause cardiac arrhythmias, and that's why that is the right answer, potassium, right? Now let's go through the wrong choices. Creatine is important for kidney function, so it's not our direct answer. Okay. B, heart rates. You will be concerned to monitor for the heart rates if you are giving your patient digoxin, right? You want to monitor the heart rate. If the heart rate is less than 60, you don't give. But this does not apply to furosemide, a loop diuretic. Okay, so that makes that answer wrong. And the last one is temperature. Guys, let me tell you something. If your patient is on IV antibiotics, you have to monitor their temperature, okay? Or if they just had surgery, you have to monitor their temperature for infection. But so this does not directly impact this question, so that makes this answer wrong. Okay, so temperature is wrong. You do not have to assess temperature before you give furosemide to your patient. Okay, what is the most common cause of right-sided heart failure? A, chronic kidney disease. B, untreated hypertension. C, left-sided heart failure. And D, hyperthyroidism. And guys, the right answer is left-sided heart failure. You know why? Because in left-sided heart failure, right, the left ventricle is unable to pump the blood to the rest of the body. Okay, and this blood now backs up into the lungs, causing pressure in the lung and congestion in the lung, and that is when you see pulmonary hypertension, right? And if you as a nurse, if you listen with your stethoscope to listen to their lungs, you will hear crackles. That's because the blood has been backing up into the lungs. You will hear crackles. That's like fluids in the lungs, and the patient will feel autopnea, dyspnea, right? So now that there is pressure and congestion in the lung, the right ventricle is supposed to pump blood into the lungs, and now there is pressure in the lungs, the right ventricle have to work very hard, right? Because the left ventricle is already weakened, and that's why it can't pump blood to the rest of the body, and this blood back up into the lungs. Now the right ventricle that's supposed to pump blood into the lungs have to work hard, because there's pressure in the lungs, have to work hard to pump blood into the lungs. And then gradually, after working hard so much for so long, the right side of the heart also starts failing, and that's how left-sided heart failure leads to right-sided heart failure. Okay, guys, I hope I was able to explain that well. The wrong choice is chronic kidney disease. Okay, this condition can contribute to heart failure, but they are not as common or really directly as the left-sided heart failure. Okay, untreated hypertension, same thing. It can contribute to hypertension. It can contribute to heart failure, but not as much as left-sided. Left-sided is the main one. Okay, and D, hyperthyroidism. Hyperthyroidism can also contribute to heart failure, but like I said, it is not the major. They are just like on the side. They are not the major cause or leading to right-sided heart failure. Now let's go. Which findings are indicative of right-sided heart failure? They are simply asking you for the signs and symptoms of right-sided heart failure. JVD, jugular vein distension, lung crackles, ascites, hepatomegaly, and autopnea. So let's treat it as true or false. JVD, absolutely. Like I said, jugular vein distension for the right-sided heart failure. Like I said, when you're thinking about right-sided heart failure, the signs and symptoms you're going to see will be affecting the periphery, the rest of the body, just like I've explained to you, okay? And so JVD is right, true. Now, lung crackles, no. That's for left-sided heart failure, okay? So this is false. Ascites, absolutely. Because the blood is backing up into the organs, so it's expanding. So ascites, the stomach swelling, yes, absolutely. And D, hepatomegaly. Absolutely, this is enlarged liver, because the blood has been backing up in them. There's no way to go. It's not going to the lungs, okay? So D, hepatomegaly, this is absolutely correct. Enlarged liver, absolutely correct. And autopnea, like I said, will be signs and symptoms you will see in left-sided heart failure. Now, a patient with right-sided heart failure gains 4 lb in 2 days. What is the nurse's priority action? That is immediate action. Now, recheck tomorrow. Notify the provider, restrict protein, and give potassium supplements. Guys, the right answer is notify provider, because if they could gain 4 lb in 2 days, right, this means they are retaining a lot of fluids. So you have to notify the provider if they want to put them on a treatment or give them furosemide? What is the nursing intervention that have to be provided? Because their gaining weight actually indicates worsening of the heart failure because they are accumulating so much fluids in the body. Okay, guys? Now, let's go through the wrong choices. Recheck tomorrow. So you are telling me you find out that your patient that has heart failure gained 4 pounds, right? In 2 days. And of all the choices you can do is to leave it, do nothing, do not notify the provider, just wait to recheck it tomorrow. You know, by tomorrow, the situation can worsen. They'll be getting more and it will worsen the situation. That will cause pulmonary congestion. They can have difficulty breathing. It's going to worsen the situation. So immediate action has to be done. You have to notify the provider. So do not wait till tomorrow, please. So now C and D, restrict protein or give potassium supplements. These are unrelated to acute weight gain, okay? Because that's what we are really talking about. Okay, next one. In a patient with right-sided heart failure, which finding signals potential left-sided heart failure progression? Now, ankle edema, crackles in the lung bases, urine output of 50 ml per hour, and D, distension abdomen. Guys, the right answer is B, crackles in the lung bases, because they are asking you that the patient has right-sided heart failure, but which of these signs and symptoms you will see that would notify you that the left-sided heart failure is worsening, right? And you know, like I said, look at the question, which findings potential left-sided heart failure. When you hear left-sided, you are looking for the lung sound, the lung signs and symptoms, crackles in the lungs. Crackles in the lungs, that's related to the left-sided heart failure. So do not be tricked by the first part of the question that says in a patient with right-sided heart failure. Okay, guys, please. Okay. Now, ankle edema, this is related to right-sided, like I said, urine output of 50 ml and distended abdomen. These are common signs. These are common for right-sided heart failure. So they are not signifying or indicating that left-sided is worsening. The only one that is indicating that the left side is getting bad, worsening, is crackles. And you have crackles is fluids in the lungs, congestion, pulmonary edema. Okay. Which client statement shows a misunderstanding of left-sided heart failure management? A, I'll sleep better when propped up. I will weigh myself daily. I'll increase fluids. And D, I'll report difficulty breathing. They are asking you for the wrong statement, right? So misunderstanding, you are looking for, if someone that has heart failure make this statement, you have to educate them because the statement is wrong. So the right answer is I'll increase fluids, which is C. So the reason why is because they already have left-sided heart failure, right? And one of the concerns with left-sided heart failure is you accumulating fluids in the body. So if they should increase their fluid intake, they will accumulate more fluids. So for them, it's best they restrict the fluids or keep them on the regular volume they take every day, right? Because increasing fluids, like I said, will worsen pulmonary edema, right? Because they'll be accumulating more. But another thing you need to take note is that if your patient have left-sided heart failure and the doctor prescribes furosemide for them, diuretics, loop diuretics, right? You know they are losing fluids. It will be hard to restrict their fluids. It's best they maintain the regular volume of fluids they take every day, because if you should restrict their fluids and they're already on furosemide that help them to lose fluids, that can lead to, because now they are losing so much fluids and then they are not taking, there's no intake of fluids, but they're taking, excreting a lot out. That can lead to dehydration and hypotension. So if they're taking furosemide, they maintain the same volume. They shouldn't increase it or decrease it, okay? But if they are not on medication, they should restrict, because if they are taking too much fluids, it's going to cause more retention of fluids in their body, okay? So let's go through the wrong choices. I'll sleep better when propped up. Absolutely. For left-sided heart failure, I told you see dyspnea, autopnea, difficulty breathing while lying down. And that's why most people with heart failure, they sleep in a recliner and they position the bed in semi-Fowler, like 60 degree or 90 degrees angle positioning to be able to sleep, and they use like 3 pillows to prop them so that they can breathe properly, because if they lie flat, that causes more pulmonary congestion, and that leads to difficulty breathing while lying flat, and that's where you see autopnea. So patients with left-sided heart failure, sometimes it's best for them to sleep in a recliner and prop with pillow. So if your patient made this statement, it is absolutely correct. I'll weigh myself daily. Absolutely, like I said, weight check is the most accurate way to know your fluid status. So that's why in patients with heart failure, you have to monitor their weight. You want to know if they are gaining fluids, if they are accumulating fluids or losing fluids, and you see it with the weight. Okay. I'll report difficulty breathing. Absolutely, if they have left-sided heart failure and they are having difficulty breathing or shortness of breath, they have to report it. So this statement is correct. The only wrong statement here is I will increase fluids. Okay. Let's go. Which long sound in a left-sided heart failure patient indicates immediate concern? Soft wheeze, fine crackles at the base, diminished breath sounds, and D, coarse crackles with pink sputum. And what is your right answer? What is your answer? Guys, the right answer is D. Guys, see, when you look at B and D, almost similar, but look carefully. Pink sputum. When your patient with heart failure, especially left-sided heart failure, have crackles with pink sputum. Pink sputum suggests or indicates pulmonary edema, pulmonary congestion, and it needs to be addressed immediately. When you see B, fine crackles at the base, okay, crackles, you say, okay, that's crackles, fluids, right? But with D that says pink sputum, that is showing that the pulmonary edema is getting worse. That is, it's acute pulmonary edema or congestion, and it needs to be intervened immediately. So for A, soft wheeze, it is very common and it's less concerning as to D, pink sputum. B, fine crackles at the base. It may indicate congestion, but it's not as emergent as pink sputum, okay? And that's why we went for the D instead of B. Diminished breath sounds. This is less urgent, right, compared to that pink sputum. And patients with left-sided heart failure, it could be normal variability for them, right, because they already have left-sided heart failure, and diminished breath sound may not be a concern for them, right? So it is less urgent. It is less urgent compared to pink sputum or coarse crackles and pink sputum. Now, what causes autopnea in left-sided heart failure? A, abdominal pressure from ascites. B, increased pulmonary congestion when lying flat. C, venous pooling in legs. And D, reduced kidney perfusion. Guys, you should already know. Even if you do not know increased pulmonary congestion, but when you see when lying flat, that's autopnea, difficulty breathing when lying flat. So you already know that your right answer is B, increased pulmonary congestion when lying flat, because lying flat increases venous returns, and this worsens pulmonary congestion or fluid accumulation in the lungs and leads to difficulty breathing while they are lying flat. Okay, so that's why that's the right answer. Now, A, abnormal pressure from ascites. Remember, the question said left-sided heart failure, and ascites is seen in the right-sided heart failure, so you know that is wrong. Okay, guys, let's go. Which medications primarily lower afterloads in left-sided heart failure? A, lisinopril. B, losartan. C, furosemide. D, hydralazine. And E, spironolactone. So guys, let's do it. Lisinopril is ACE inhibitors, right? Losartan is ARBs, right? And hydralazine is vasodilators. And these three are the right answer because they all reduce systemic resistance. Now, let me explain preload and afterload for you so that you can understand what this question is asking you, okay? So when you're talking about preload, you have to think about, let's think about a balloon. Let's represent the heart as a balloon, right? And in that balloon, let's think about inflating it with air. You're pumping air inside it, or maybe you're even pumping fluid, water inside it. So think about the heart as a balloon, and then the volume of blood that is being injected inside the heart. The volume of blood. So the preload is like the amount of blood, the volume of blood that is filling the heart, right? And as the blood is filling the heart, it's filling the heart before the heart eventually pumps the blood out, right? So think about the afterload now as after the preload has happened, the volume of blood has been filled, the blood has been filled into the heart. Now the heart is full and is ready to eject the blood out, right, to the body. So the afterload is the force of resistance the heart have to push against to pump the blood out. That is the afterload, okay guys? So maybe now if I repeat the question, you understand what they're saying and you understand why we chose those three medications, okay? So the question again now says, which medication primarily lower afterloads? The force of resistance the heart have to go through that lowers the afterload. The preload has been done, now we're talking about afterload. And you know Lisinopril, ARBs, they lower the blood pressure. That's the resistance, the pressure the heart had to use to pump the blood out. Okay, so furosemide is loop diuretic, potassium wasting, and spironolactone is potassium sparing, and they reduce the preload and not the afterload. Okay, guys, which teaching is appropriate for a patient with right-sided heart failure? A, increase fluids. B, check BP daily. C, daily weight before eating. And D, avoid protein. And the right answer is C, daily weight before eating. Like I've explained so far in this video, in this NCLEX review, that weight check is the most accurate way to know your fluid status, to know if you are losing or gaining fluids. Okay, so they have to, for the patients with right-sided heart failure or even left-sided heart failure, they have to weigh themselves before eating in the morning. Okay, and increase fluids. I explained this before. You don't want to tell them to increase fluids. You do not want to tell them to increase fluids because it can cause more fluids accumulation in the body. And B, check blood pressure daily. If they have hypertension, it's really advisable daily. But this is heart failure, right? It's not really necessary as much as checking the weight. Okay. And D, avoid protein. It's not directly relevant to right-sided heart failure. Okay, unless a condition, other conditions exist that may require them to avoid protein. Okay, guys. Now, JVD, pitting edema, and ascites are most indicative of what? Pulmonary embolism, left-sided heart failure, right-sided heart failure, and acute kidney injury. This is very simple. We all know this, that this is C, right-sided heart failure. I mentioned the signs and symptoms for the right-sided heart failure, and you need to go watch my video where I explain the difference between right-sided and left-sided and how to help you guys remember the signs and symptoms. Okay, guys, so go watch it. Now, which medication increase cardiac contractions? Now, spironolactone, metoprolol, digoxin, and furosemide. I know you all know the right answer. I believe you do, because as you can see, digoxin is the right answer, because digoxin is a positive inotrope that helps to increase cardiac output, right? So you know. And you know, another thing to take note of is when you are giving digoxin, right, you have to check your patient. I cannot emphasize this enough. Potassium level, because hypokalemia, that is low potassium, will cause digoxin toxicity. Okay, and that's when they start nausea, vomiting, change in vision. Okay, please. Like spironolactone, furosemide, they both work on fluid balance in patients with heart failure. Is either to lose fluid or to maintain potassium. Okay, and metoprolol helps to lower the heart rate and the blood pressure. The double L's, lower the heart rate and blood pressure. So the right answer that increase cardiac contractility is digoxin. Which symptoms should prompt concern for digoxin toxicity? I really and literally just explained this. Now, nausea, this will be select all that apply. Yellow vision, bradycardia, diarrhea, and muscle pain. Guys, what is your answer? The right answer is A, B, and C. Right? You know, like I just explained, I literally just explained that digoxin toxicity due to hypokalemia will cause nausea, will cause vomiting, yellow vision, like I said, change in vision, yellow vision, bradycardia. I also forgot to tell you that you have to monitor the apical pulse for at least 1 full minute before administering digoxin. Okay, take note. What indicates an ACE inhibitor is working in a heart failure patient? Increased potassium, decreased urine output, blood pressure drops from 160 to 130, 160 over 90 to 130 over 80, shortness of breath. You know what ACE inhibitors do. ACE inhibitors is used to lower the blood pressure, right? And when you're taking ACE inhibitors, you also have to be careful of hyperkalemia, because ACE inhibitors blocks the RAS system, right? So the potassium is not getting out of the body when you're taking ACE, so it can cause increased potassium. So the right answer is C, blood pressure. It's very obvious. Blood pressure of 160 to 90 drop to 130 over 80. Okay, increased potassium will not be indicating that ACE is working, will be a concern. Okay, and decreased urine output and shortness of breath are concerning signs that need to be addressed or reported. But the only one that's showing that okay, the ACE inhibitors that you're giving your patients is providing the therapeutic effect, that is doing the exact thing you want it to do, is lowering that blood pressure. Why is spironolactone used in heart failure treatment? A, promotes diuresis and potassium loss. B, blocks aldosterone and retains potassium. C, slows heart rate and lowers blood pressure. And D, boosts cardiac output? Well, no. The right answer is B. Blocks aldosterone and retain potassium. It blocks the RAS system, aldosterone. Okay, that's because potassium is a spironolactone is a potassium sparing. So you should, once you see that, you know. So spironolactone is an aldosterone antagonist, right? And it saves potassium and helps with fluid regulation. Okay. So A, promotes diuretics and potassium loss. You know, like I said, it helps you save potassium. So that is wrong. And C, slows heart rate and lower blood pressure. This will be function of beta blockers. They lower the heart rate and blood pressure. And D, boosts cardiac output. This is for digoxin. It helps cardiac contractility and boosts the cardiac output. Okay. Now, a patient on furosemide and digoxin has potassium level of 2.9. What is the priority action? Encourage dietary potassium, hold both meds, administer potassium and notify the provider, monitor urine output. Guys, let me explain this to you. This patient is on furosemide. Furosemide is a loop diuretics, right? It helps you to lose potassium. And digoxin, and you know that since furosemide helps you to lose potassium, you are fluids and you lose potassium in the along the way, right? With it. And digoxin, and the patient is also taking digoxin, and you know hypokalemia, low potassium, will cause digoxin toxicity. And look at their potassium level, 2.9. So this patient that already has a potassium level of 2.9 that is taking digoxin might likely experience digoxin toxicity, because hypokalemia will cause digoxin toxicity, because regular potassium is 3.5 to 5, right? Normal range, right? Now, so what should you do if you experience this? The next thing is to do is to administer potassium and notify the provider, because they are on digoxin and their potassium level is 2.9. So you want to boost the potassium level so they don't have digoxin toxicity. Okay. And after you give them that potassium, you notify the provider. This one say A, encourage dietary potassium. Dietary potassium is very slow. They need something urgent because they're taking digoxin with it. They are on furosemide and digoxin. So you are encouraging them to take dietary potassium through food. It's very slow. It's very slow, right? It's insufficient alone too. Monitor urine output, okay? Yeah, if they have heart failure, you should monitor urine output. But it is not helpful in addressing the hypokalemia that they are experiencing, because we are dealing with hypokalemia, okay? All right. And let's see, guys, if you've been enjoying this review, please do not forget to subscribe. Do not forget to like, comment. Thank you. And what should patients taking beta blockers for heart failure be taught? Take it even if you feel well. Stop. This is select all that apply. Stop immediately if tired. Change position slowly. Monitor heart rate before each dose, and take on an empty stomach. So treat select all that apply as true or false. Take it even if you feel well. Absolutely. You do not tell your patient to stop beta blockers abruptly or any medication abruptly, okay? Stop immediately if you feel tired. No, this is wrong. This is false. Now, change position slowly. Yes, because beta blockers, like I said, lowers the heart rate and blood pressure. So if they're taking a medication that lowers the heart rate, they have to change position slowly, because it can cause orthostatic hypotension, that is sudden drop of the blood pressure while standing up. And then you have to tell them if they say they feel dizzy. If you are trying to get your patient that is on beta blocker up, and immediately they stand and say they feel dizzy, they feel tired, you have to put them back on the bed and let them sit or lie down, okay? Monitor heart rate before each dose. Like I said, yes, beta blocker, monitor the heart rate before giving, because they lower the heart rate and blood pressure, okay? At least for 60 seconds. That is full 1 minute. And E, take on an empty stomach. Timing with food is not required with beta blockers, so that's really not necessary, okay, guys? And the last one, we made it. What is the most important action before administering digoxin? Check apical heart rate for 1 full minute. Monitor blood pressure. Measure urine output. Check hemoglobin. Like, I know you, my students, know the right answer, because from everything I have been yabbing all through this video, you know the right answer, right? And the right answer is drum roll, A, check apical heart rate for 1 full minute. We all know why. Digoxin will lower the heart rate, right? It helps cardiac contractility, right? It increases cardiac output. All right, guys, thank you for watching.